Hi, this is Caliendo, and I'm going to use my doctor title today to take advantage of my PhD. And I want to give all of you lovely Nevada kinship caregivers just a little bit of a lesson that I teach to the UNLV doctoral policy students on policy change. So to set the stage, I've been very concerned and equally outraged with the stories that I see you all posting on our closed Facebook group. I am really saddened to hear about what's going on with the kids and the situations in your home. And I want to talk to you a little bit about how I've approached change in the past, because I think no matter what your issue is, some of these pillars of change are going to help you get your story out there in a way that affects real change for the kids in your home. So just a brief overview of policy change. There's a couple ways to think about it. So there can be change that needs to happen based on how the organization is practicing or living out their policies. So the way a caseworker is interpreting Department of Family Services policy, if one is interpreting it different than another. So that we're looking at kind of informing the agency of differing practices. There can be judges that interpret our law differently, and we also need to raise that to attention. And then there's the issue of just the law being either inequitable or having unintended consequences of harming children or families. And so it's very important to understand the landscape of federal, which is the federal government, the law around child welfare, how the states interpret the federal government's laws and their own individual state laws, and then how individual child welfare agencies are implementing state and federal law and their own policies, which can go above and beyond whatever those laws are, and then how those line workers are interpreting the policy. So my PhD is in something called public affairs, which means I have looked at how all these laws and policies intersect with families and get down to the creation of kinship families. So my specialty is child welfare law policy, and I really care about children in kinship care. So I'm going to share a little bit about what I've done in the past, sort of give you guys hopefully a little bit of a tool to take forward if you choose to. Now, to step back for a second, our CAN meetings, our Kinship Advocacy Network meetings, which we have every first Thursday, this is in place of that. We have been getting you guys together, listening to your stories, and kind of putting together, including with a survey that hopefully you all had a chance to take, what are the biggest issues right now for Nevada kinship caregivers that we can drive forward for change, both in administrative change and legislative change for the upcoming session, which starts in 2021. So we've been doing that, and we've been sharing all the things that we've been working on, and we've identified a couple of areas based on your stories that we're pursuing for change this next session. However, some of the things that I'm seeing on the group are not necessarily addressed in the work that we're doing specifically as the Kinship Advocacy Network, and I don't want you to feel left out or that your story doesn't matter, because it absolutely does. So let me share my own story and my own journey so that you can see some of the tools that I've developed over the years. I'm going to start by sharing my screen, hopefully. And you should see this very tragic headline, a murder trial set for 3 in the shooting of a mother and a 12-year-old girl. So the way I come into this is 2010. I have just recently moved to Las Vegas from Seattle. I am new to child welfare, and I'm fresh off a master's in family systems, and so I am working directly with children in foster care on mental health counseling and really working on trauma. So there are these 4 children who were all in a 1-bedroom apartment with their mom and dad. Their mom and dad were not only using drugs, but I believe that their dad was potentially selling. And what happened was one night there was a drug deal that had kind of gone sideways, and the mom was shot in the face in front of all of her children, and she died. And the 12-year-old daughter was also shot in the stomach, and dad was part of this, so he was incarcerated. So pretty quickly these kids came into foster care. They were at Child Haven, and then thankfully a great aunt stepped up and took all 4 kids into her home and made sure that they stayed together, stayed connected to family, stay connected to each other, and she really was instrumental in just not adding to their trauma by having them be separated into other foster homes and separated from each other. So I was working with the family at the kid level, not with the aunt. This is far before I knew anything about kinship care, but I was just observing what was going on in their home. And first thing I noticed was this aunt was dedicated and she did everything she needed to do for these kids, including she ended up having to quit her job because she had to care for them. They had some high needs, and so she used all of her FMLA, and then she made the decision to care for the children. So about 6 months into this, where I'm in and out of her house working with the kids, I hear that she's got issues financially, which makes sense. She's been doing this work as what we now know an unlicensed kinship caregiver. So the kids are in foster care, but she has been caring for them without any support from the agency. In fact, she didn't know there was support available. So at 6 months, she reaches out to the kids caseworker and says, you know what, I really need help. I've, drained my savings. I am kind of needing some additional support. What can I do? At that point, 6 months into this case, the caseworker said, oh, well, I think you can get licensed as a foster parent. And they sent her over to kinship licensing. So she's 6 months behind at this point from the help that these kids have really been entitled to. And what she does is she goes through the licensing process, which takes an enormous amount of time because there's a wait list for classes. She can't get all the things she needs done quickly because the agency itself is backlogged. So fast forward, she gets everything she needs done for licensing. A lot of you watching this have probably gone through this process. They come out to do the home study. Now, in 2010, things were different. So when they came out to do the home study and they were measuring the bedrooms, there was no such thing as waivers. So what they told her was, your bedroom is too small for these kids. You don't have enough square footage, so you're not going to be able to be licensed for these children, which just means she gets to continue doing the work for free. That didn't discourage her. She kept going. She kept fighting. She actually found a location in her neighborhood that was slightly bigger that she could afford over the long haul. And she just needed about $800 to move so that she was in a place that was big enough to get licensed so that she could finish her license, get the financial support that she needed, and continue on. So at that point, like I said, she had drained all her savings. She was doing everything possible. She reached back out to her caseworker. She said, I just need $800 to be able to move so I can get all this stuff in place. And instead of the support that I, at the time, expected she would receive, she was told, it sounds like you can't do this. Sounds like you don't have the financial means to care for these children. So what we're going to do is we're going to go ahead and remove them and place them back at Child Haven. I, as an outside observer, was absolutely shocked that that is the choice that the agency was going to make, as opposed to invest $800 for long-term stability for the family. And it was, in fact, that moment that made it so I changed my entire life, and I figured out how to raise $800 for her, get her moved, and start a nonprofit, which is Foster Kinship, in order to help other families in her situation. So that was a moment for me where I was incredibly angry. I was outraged. I could not believe that that was the system that was working kind of on behalf of kids. I was like, that's not for kids. These kids need to stay together and they need to stay with their aunt. I mean, that was so common sense to me. And I was pretty naive as to the landscape of laws and policies that were at play, that I was just kind of going to bull my way through and make sure that this family stayed together. So this is why I started Foster Kinship. And since I started Foster Kinship, I was really working to address the issues that we're seeing in terms of the inability for families to know about the resources available to them. They shouldn't have to wait to get licensed. They shouldn't have to wait for financial support. Kinship families should be treated the same as foster families. They should get paid at the time of placement. They should get training. They should get everything that children in traditional foster care receive, because that just seemed equitable to me. So what can Foster Kinship do about it? So we're a nonprofit organization that I literally started because this one story angered me so much that I wasn't going to let it stand. And so I spent a couple of years researching all of the issues before I founded Foster Kinship. But really, I founded Foster Kinship based on this premise that children in kinship care deserve the same support as children in any other home. And it didn't feel right the way the system was set up. So what have we done in this very specific area? Since this time, so that was 2010, I took a couple of years to figure out how to start a nonprofit and research kinship care. So I dedicated about a year and a half to making sure I knew what I was doing. And then once Foster Kinship opened, I started figuring out what financial support was available to families, and we started doing child-only TANF applications for families so they could get financial help until they received licensing. We also do child-only TANF for any family outside of the foster care system too. But it was a way I felt that we could get information and actual tangible support to families that weren't receiving it because they weren't told about these benefits. We also developed a roadmap that you may or may not have seen for Department of Family Services so that all families receive something in their hand that said there is outside agency, Foster Kinship, that is going to walk you through the process and make sure you understand your rights and responsibilities. And at this point, we're forging a partnership with the Department of Family Services because that is the system that I'd like to help reform. We also then got a contract to do information sessions in 2015 to help kinship families. And I would just go to different areas of DFS. Some of you met me at a kinship info session. And I would literally just say, hey, I'm Allie. This is the stuff you guys need to know. Here's how we can help. Here's what the agency is going to do. Here's what you can change and control. Here's what you can't. So I'm trying to get accurate information into the hands of families as soon as you get placement, because otherwise things kind of just happen to you. You don't know what's going on. We're very grateful that the Department of Family Services saw that, yes, this was a need that they wanted to change. The leadership understands when I say this is going on, they want to partner with us and help this change. They don't want families to be treated this way. So there's a lot of positive in terms of partnering. And then in 2016, we took over the licensing classes for DFS. So the way it was back in 2010 was families had to wait 6 months to even get into a class. There was a wait list of 100 families at one point when I reached out. If you were waiting to get financial help and you have to wait 6 months just to get into a class, you tell me how that works for the kids in your home. It doesn't. So we took over the classes. A lot of you have met us through kinship classes, and you may not have known that that was a big fight for me to get that into our nonprofit so that we could give you access to classes immediately instead of waiting. We also provided childcare so that there was less barriers. We're doing everything we can to break down the barriers that we identified in that one problem from that one family that I was working with. In 2017, there was a backlog in our community of car seat training and CPR training. So we got trained. I trained my staff, I trained myself, and now we offer that for free for kinship families so that we can get you through that portion of licensing. We do licensing application sessions. We do the QPI here at our office. We do all of these things because that one family, that story angered me so much that I wanted to change it for the thousands of families that came after her. So what can Foster Kinship do? We can do a lot, but we need to know what the issues are. We now are I write grants for a whole bunch of private foundations, and I'm always reaching out to individuals to say, hey, kinship families need housing, kinship families need respite, kinship families need car seats, right? This stuff doesn't just come. There was no funding stream for this. There's no one place that just gives us money. It is us pounding the pavement and making sure our community understands the needs of kinship families and provides Foster Kinship, the nonprofit, with the ability to support you all from what I'm hearing from your stories. So I'm going to go into the next part. I'm going to probably stop the video here for those of you that may need to take a break. But I'm going to talk to you a little bit about one thing that we did do, which was change the law to allow fictive kin who have kids in foster care to access child-only TANF. And we did that finally in last session, and it was finally put into place in July 1st of 2020. So I guess I'm going to end by saying I'm going to share how we've changed the law. I'm going to share a little bit of how we are able to partner with the agency in order to affect change for kinship families. We're not partnering with the agency because it's like good for us financially or anything like that. We're doing it because there was a big problem and I want to see these changes happen. And to do that, we have to figure out what levers to push, at where, what level to intervene, and how to make sure that the people who are charged with serving our kids and families, which in Clark County is DFS, how are they knowing what the issues are and then working to change them? So if it wasn't for that one family's story that I witnessed, I wouldn't have known what an issue in terms of policy change was needed for kinship families to be licensed, to understand their rights and responsibilities, to have the barriers broken down. So I want you to feel heard because your story matters very much to me, and I know to you all as you're listening to each other. These things need to change. but it is possible to affect change. It is possible. And so in the next video, I will share a little bit about how we did it for this very specific way with the child-only TANF law. And then I'm going to give you just some basic stuff that I would give my students in the doctoral policy class so that you have those framework to make change for yourself if you choose to do so. So I'll stop it now. See you in the next video. And guys, hang in there because it matters. Change is slow, but it is happening, and there are people listening. And if it can't happen through what Foster Kinship is doing, it can happen through what you're doing. And I just want to show you how to do that. Okay.